Keeping an eye on health, June is Alzheimer's and Brain Awareness Month. And earlier this month, an FDA advisory committee endorsed an Alzheimer's drug known as Lecanemab, meaning full FDA approval could be coming soon. So joining us today is Dr. Arif Dalvi. He is the Director of Memory Disorders Center at St. Mary's Medical Center. Welcome. Thank you so much for joining us today.
Thank you for having me.
And my first question for you today is, how exactly does this drug work and what should people know about it?
So imagine you have a nice, restful bedroom, but somebody dumps all kinds of crumpled and misfolded clothes in there. Oh. You want that cleaned up, right? So in Alzheimer's disease, there's a misfolded protein called as amyloid that accumulates in the brain, and this kills the brain cells associated with memory. So lecanemab is trying to clean up that misfolded protein.
That was such a great way to explain it to people at home because nobody wants to mess with their laundry. So when should someone see a neurologist that specializes in memory care?
So if you're having trouble that is affecting your quality of life, whether at home or work, simple examples being you forget a route that you're used to driving on, or you forget the name of a good friend, that is not too late to start talking to a neurologist, because as you'll see with this drug, you want to treat this condition early on. You cannot wait until it has advanced.
So you're saying don't wait to go to the doctor. Definitely just take that extra step.
The other reason to see a neurologist is we can screen for reversible causes of memory loss. Sometimes it can be something simple as a vitamin B12 deficiency or a hormonal imbalance that is easy to find and fix.
And that is great information. And how can people reduce the risk of developing dementia in the first place? Is there a way?
So the key things that we're looking at is control your blood pressure, your cholesterol, your blood sugar, avoid smoking, avoid excessive alcohol use, physical exercise on a regular basis, and something like a Mediterranean diet can be helpful.
And locally, what has been a breakthrough recently with Alzheimer's?
So one thing we are working on, which only a handful of medical centers in the United States are doing, Dr. Lloyd Zucker, my colleague in neurosurgery, and we are teamed up on a project that is part of Governor DeSantis's Brain State Project. And what we are trying to do is remove amyloid again from the brain, but using a new technology called focused ultrasound. So we are trying to do the same thing that the drug does, but in a way that avoids some of the potential risks of the medication, such as brain swelling and brain hemorrhage.
And I think something to just take away from this interview today is, like you were saying, it's never too late or early to at least mitigate the risks and see a professional.
Exactly. There's a lot you can do in terms of prevention.
Absolutely. Thank you so much. And we're going to go ahead and check in now with the forecast and meteorology.